What's going on, guys? Happy Saturday. My name is Dr. Philip Ross. I'm one of the chiropractic physicians here at the World of Wellness. And at this 11 a.m. spot, my speech is titled Biohacking Sports Performance Through Chiropractic. So today I'm just going to kind of touch about what chiropractic does for the athlete. And we'll talk about kind of just like straight chiropractic, if you will. So just like getting adjusted, and then we could talk about different adjunct therapies and different modalities we could use for the athletes if they're a little bit more banged up or if they have a little bit more of a significant injury. Um, and I guess we'll just kind of start it off with why chiropractors or why professional athletes see chiropractors is because they feel you feel a ton better. And one of the first athletes that kind of put chiropractic on the name out there was Jerry Rice. And I think it was like what, Frank, mid 80s, 84, 85. And so Jerry Rice started seeing a chiropractor, and then Joe Montana started seeing a chiropractor. And then the whole San Francisco 49ers team started seeing one. And now today, every single NFL team, all 32 teams, have at least one chiropractor on their medical team. Some teams, such as like the Detroit Lions, and I think a couple others have two. But they just basically see how well, or how patients and how athletes respond to getting adjusted, and it just kind of keeps your body just functioning how it should. So um and also too, almost every single NBA and MLB team have a chiropractor on the medical staff. One of the only teams in the MLB, I think there's only three that don't have a chiropractor, is the Pittsburgh Pirates. Go figure. So they don't have one. Yeah. And then lastly too, golf's pretty big, got really big over COVID. And right now we got the Open Championship, one of the majors, over Royal Troon. And most of these PGA golfers and the LIV golfers, they have their personal chiropractor. And if they're not credentialed in that country or that state, they actually supply every single tournament a chiropractor on staff, just because it's we'll kind of touch on it. It kind of helps with your sympathetic and your parasympathetic nervous system, and it basically just kind of helps your brain body connection, which is absolutely vital in a golf swing. So we will kind of just jump into what chiropractic does for your brain and body. So when you receive a chiropractic adjustment, there's a couple different things that happen. So first of all, it's going to restore mobility to fixated joints in your body. And a lot of people think if you just see a chiropractor, they're only adjusting your neck or your mid back or your low back. Not true at all. I mean, there's a ton of athletes that come in with elbow problems, ankle problems, knee problems, and you could do adjustments not only to the spine but different extremities of the spine as well. And when you adjust certain segments in your spine, um, basically it's going to increase your range of motion. And the biggest thing what it's going to do for you if you're an athlete is it increases something called your proprioception. So proprioception is a big word for how your body feels in space. So let's take an example, like an NBA basketball player, right? So say someone's going to the rim for a layup and they kind of get bumped, and their body weight shifts, their foot might turn out, and then their brain basically has to change how the next step's going to go down so they actually perform the layup. So when you get adjusted chiropractically, especially in your cervical spine, your neck, that is going to really help with proprioception. So it kind of helps your joints feel where they are in space better, is the technical definition. Um, and then also, which I kind of want to dive into, which is pretty cool. Dr. Heidi Havoc, she's one of the best people coming out with a lot of literature what chiropractic does for your body and for your brain. She talks about how it stimulates your prefrontal cortex. So your prefrontal cortex, it is basically a center in your brain. It carries out your executive function. And so when you get your cervical spine adjusted, let me go to this article here. Um, it basically stimulates your prefrontal cortex, and we were talking about how that there's nine huge functions, and it's called your executive brain. So it actually helps with your empathy, insight, response, flexibility. It helps with body regulation, and actually your center for fear modulation as well. And so not even for the athletes too, like I treat a couple people on the spectrum, they have autism, and the reason why their parents are bringing them in about once every other week or once a month is you have your autonomic nervous system, and you have something called a sympathetic nervous system and a parasympathetic nervous system. So sympathetic nervous system is your fight or flight response. So like you see a bear in the woods. So what happens? All your blood vessels vasoconstrict, eyes vasodilate, blood pressure, heart rate go up. When you get your cervical spine adjusted, your neck, it instills the parasympathetic nervous system response. So it's kind of like your rest and digest. So the reason why, I treat 3 kids almost every other week that are on the spectrum with autism. Once we kind of got over the whole like touching aspect of it, because they're high sensory. Once they felt comfortable with me and we were actually able to adjust their cervical spine, they come in, yeah, basically every other week or once a month, just because it really truly down regulates your nervous system, just so you're not running in the sympathetic overdrive. So if you're an athlete, adrenaline's great, right? But there's some times where you need to be a little bit more controlled and a little bit more in tune with your body and kind of down regulate your nervous system and kind of drop your heart rate. For example, golf. I mean, you don't want to be standing over a golf ball with your heart rate in the 120s. You kind of want to be in the, I would say low 60s or upper 60s, just so you can kind of focus and let your body do what it wants to do. Um, and so going back to the prefrontal cortex and all the work that Dr. Heidi Havoc did. So she said a study conducted in the Spinal Research Foundation in a journal, Neuroplasticity, shows that chiropractic spinal adjustments significantly increase activity in the brain's prefrontal cortex, the area where higher learning and cognition happen. The prefrontal cortex plays a central role in cognitive control functions and dopamine, and it modulates cognitive control, thereby influencing attention, impulse inhibition, prospective memory, and cognition. So if anything, it's just going to kind of help your brain function how it should in a little bit more properly there too. And so what the chiropractic adjustment is going to do, it's basically going to increase your proprioception, kind of help with your brain all the way down to your body. And then lastly, everybody thinks that you just see a chiropractor for adjustments, but there's a lot of athletes that are actually going to chiropractors for other things. We're actually affiliated with a doctor of chiropractic down in Florida. She actually doesn't even adjust; she just does lab work. So there's a guy named VJ Singh. He used to be a yeah, he used to be a pretty darn good professional golfer, and I'm pretty sure she doesn't even adjust them. She basically just kind of fine tunes his lab work. So that's something we do over here at the World of Wellness as well. Not only am I treating people, we have different adjunctive therapies that I'll touch on, but we do a ton of lab work as well, just because very fortunate and blessed that we have the whole nutrition store out there. So usually I kind of just like to get a baseline of people's biochemistry. And instead of people coming in and saying, oh, maybe I'll take this supplement, take that supplement, let's actually get an objective measure, see what your blood's reading, and then we could kind of fine tune your supplementation. What also athletes are seeing chiropractors for, just not getting adjusted, but different types of stretching and modalities that we do. So, my background, I have a master's in sports rehabilitation and I'm a certified chiropractic sports physician. So, I would say about 5 or 10 minutes of the treatment is actual like adjusting, but most of the time in the room is actually working on the soft tissue structures at hand. Because all these athletes, you're doing the same repetitive motion 3 4 times a week, so certain tissues are going to get really really tight and then other tissues are going to get inhibited. So what we want to do is we kind of want to do manual therapy to the tight tissue to kind of loosen it up, so everything's symmetrical and you're not having like an overuse or an overload injury. Very common. Again, I keep bringing up golf, but if you're going out and playing, 3 or 4 times a week, and you're doing the same repetitive motion in a golf swing, a lot of people sometimes get it's called medial epicondylitis, which is also golfer's elbow. It's technically like an overuse injury. So what I'll do is we'll actually adjust the elbow, wrist, even the shoulder. But then it's absolutely vital that we have to do soft tissue to the tight structures that are pulling on certain bones and joints, just so you don't get affected or get any pain, inflammation, and leading into an injury. So the different types of stretching that we do. I don't really do any static stretching. I do a lot of, it's called FST. It stands for fascial stretch therapy. And that's in your fascia. So I guess we'll touch on that. So fascia is basically just connective tissue. So think of like a pantyhose that wraps around a muscle. What we're trying to do with the fascial stretch therapy is basically unwind the fascia so everything can breathe underneath the muscle, underneath can breathe. So we do fascial stretch therapy. We also do something called PNF stretching. Some people call that contract, relax stretching. I think you get the most bang for your buck on that as opposed to just holding like a static stretch. Both myself and Dr. Orbach like to do that just because, again, you could adjust someone in about 5 to 10 minutes and they're going to feel a lot better. But why not take the extra 15 minutes and work on the soft tissue at hand just so you're going to feel that much better? um, and then also too different types of trigger point work. So I do something called we'll call it pinning and stretching. So it's basically you shorten the muscle, pin it, and stretch it back out so it makes it a little bit longer. And so we do that basically on a lot of like kind of tendinopathy issues, so tendonitis. And if you have like a tight muscle, then we'll do it on the tight muscles as well. I see one of my patients sitting over here, and we work on his shoulder. So what we'll do is we'll basically, and on his pec, because his pec's really tight. So we'll shorten the pec down, basically put a finger into it to pin it, and then we're going to stretch it back out just because it's going to make the muscle a little bit longer. Just because let's face it, everything we do in society, we're always just in the seated position. Everything's in front of us, so a lot of people's shoulders will always just kind of round forward. So what do we have to do? We basically have to shorten the pec minor so the shoulder will naturally go back, and then a lot of like the upper back tension, neck pain will kind of start to dissipate too. Um, what we also like to do too is, so I'm something called TPI certified. It's the Titleist Performance Institute. And so we basically take people through different functional movement screens and see where you move well and where you do not move well. And then we could give you basically home exercises and stretches to do at home. Because let's be honest, there's only so much we could do in a visit like once a week here. So I'm a huge advocate of like homework. So usually I'll tell a patient to bring in your phone, and I'll basically take a video of them of doing certain exercise and stretches. So you could kind of do most of the groundwork outside of the clinic, and you're just going to feel that much better. Um, I really do like the movement screens because a lot of people will come in and they'll just be like, "Hey, I got pain here or there," and I don't like chasing pain. So sometimes someone will come in with pain in their knee, right? And they'll be like, I've been walking a little bit more. Weather's nicer, hiking. I'm having some pain in my knee. Your knee is actually a very, very simple joint. So without any kind of like injury or trauma to the knee, most of the time it's actually a lack of mobility in your ankle or your hip. A lot of people have very, very tight and stiff hips just because all we do basically is sit most of the day. So usually it's from a lack of movement in the hip, what could basically lead to knee pain. So what we'll do is we'll do a functional movement analysis to take your hip through its full range of motion to see if you're limited in external hip rotation, internal hip rotation, and then we'll do some therapy in the room to kind of loosen that up, and then we'll give you homework that you could do at home just to kind of further the treatment. And most cases, if someone is significantly tight in their hip and they're having knee pain, once you loosen the hip up and get it through its full range of motion, it's going to take pressure off of the knee and your knee's going to feel a lot better. So yeah, we love doing the movement analysis. That's actually really fun too, because when people say, "Oh, my hips feel fine," but then when you actually compare one side to the other, basically internal external range of motion, you could really see a big difference, and then the patient could actually feel it as well. And again, we'll kind of just go through different things to kind of coach and get you feeling better. And then lastly, when athletes are coming in with any kind of like acute injury, so hey doc, I was at basketball practice. I came down from grabbing a rebound and rolled my ankle. I had like an inversion ankle sprain. We got a lot of cool modalities and bells and whistles back here that we could put patients on. One that I talk about a lot, just because we see a lot of really, really good results, is that class 4 therapeutic laser. To make a long story short, that is basically just going to increase your healing capacity like 100 times quicker than what you normally would. There's a ton of research on it. And actually, in this clinic, we have been using it a lot more, basically for symptomatic relief of a little bit more of like neurodegenerative disorders. So, treat a couple of patients with MS and Parkinson's. And if you actually look at the literature, you could put a certain you could basically do a certain wavelength nanometer on the laser and basically help to kind of stimulate your brain. So like if we look at Parkinson's, it's basically a lessening or a lack of dopamine in your brain. So basically, what I do is I'm treating three currently. So we'll get them on the correct supplementation, and then we'll also use the laser in certain parts of actually their head and their face, basically to get into a structure called your substantia nigra, which basically produces dopamine. So your body's naturally going to produce more dopamine, and it should kind of suppress your Parkinson's symptoms. So we've actually been having great success with that. And then what I also like to kind of couple that with is we have something called a PEMF map. That stands for pulse electromagnetic frequency. To make a long story short, what that does is that basically kind of like recharges the batteries of your cells. I had a college baseball player. He had an avulsion fracture in his ankle, and he went to the ortho, didn't require surgery, and they basically put him in a boot and said, "Hey, get off of it for 8 to 10 weeks." He would come in, and we would basically laser his ankle where he had his avulsion fracture, because that's going to bring all your good healing factors to that area. And then there's a lot of research for the PEMF mat. It's called the cloud therapy that we have. Basically, it's going to help stimulate osteoblastic activity. What does that mean? It basically just allows the cells that create newer bone and help to form bone. It allows that to kind of just really ramp up and increase. And there's a lot of research on how that actually starts to heal fractures as well. So that's what I'll do if I have any kind of acute injury with any kind of athlete coming in, whether high school athlete, college athlete, professional boxer. We will basically use the laser therapy local, and then we'll put them on the PEMF mat, because it's basically just going to allow you to heal even quicker than what you should. Cool thing about the PEMF mat, that kind of got very popular when NASA started implementing that. So you always see the astronauts walk onto the space shuttle, or you never see them walk off. And the reason is, when you are up, when you're basically up in space, you have no gravity, right? So nothing's taxing your bones, so you lose a lot of bone density. And so they found that, and they started implementing the PEMF mat onto the spacecrafts, just because some of the astronauts were getting sick, really losing a lot of bone density. And so they actually started to put those on the space shuttles, just so you could kind of just be as optimal as you can. Um, the mat that we have, the cloud, you really don't feel anything. When I get on it, I actually kind of feel it in my gut, my GI system. Maybe that's kind of like an indicator of maybe I need to kind of clean up my diet a little bit, or it happens to be that I do it over lunch, one of the two. So okay, and then we were talking about, and how else chiropractic is going to kind of help with your body as well. The biggest thing that take home that I want to get across is basically just going to help with the proprioception. So even for the wrestlers, I treat a couple D1 wrestlers, and they will come in, especially in season, at least once a month, just because I mean they're putting their bodies to some crazy different ranges of motion. And the football players too. You're basically in like a mild car accident every time you're going in for a collision or a hit. And so we are basically just trying to instill it basically instill motion into fixated segments in your spine and your extremities. And when people always ask, like, "Hey, I heard the pop. What's the crack sound? That cavitation?" That is basically a nitrogen gas exchange. So when you when chiropractors adjust, you have to go through something called a paraphysiological space. And so that when you go through that and actually like hear the crack, that is basically a nitrogen gas exchange within and out of the joint. A lot of people say, "Hey, is that going to cause arthritis?" Absolutely not. A lot of people, I know the old wives' tale, if you crack your fingers all the time, will that cause arthritis? My recommendation, instead of cracking your fingers like this, maybe try and pull on them just to kind of gap it a little bit better. But no, that's definitely not going to cause arthritis. Um, and then lastly, what we could do too, pertaining to the golf, very, very common in golfers, if you've been golfing for like years, to get like a disc herniation, usually in your L4, L5, or L5, S1, just because of the rotational movement, because the most stress and the most load on a disc in your low back is from flexion and rotation. And so every time you're addressing a ball and swinging a golf club, you're a little bit flexed and you're rotating. So what we do if any golfer gets a disc bulge or a disc herniation, we will use the laser, because essentially what a disc herniation is, think of jelly inside a jelly donut. The donut contains 22 to 24 layers of lamellar rings, and then you have something called a nucleus pulposus. It is basically like, if researchers say it's kind of like consistency of toothpaste. And so what happens is that jelly out in the jelly inside the donut kind of comes out, and then it contains 8 main inflammatory proteins. We'll just call it chemical soup. And then that's when you're going to get all your pain and dysfunction. So what the laser does actually is it basically helps to stimulate those lamellar rings to kind of like mend itself back together, so you don't have the jelly popping out of the donut, and you don't have all that inflammation and that whole cascade of events going down. So Excuse me. So I like to use the laser basically for almost all sports injuries. We do use it for a couple of things you wouldn't think you'd see a chiropractor for, just like we were talking about with the Parkinson's and the MS. But just it's really, really helped suppress their symptoms. So we like to keep using it. And then the other modalities that we have, like after seeing a chiropractor, we have something called Normatec compression boots. And those are basically big leg sleeves that basically help to flush all the metabolic waste and the lactic acid out of your legs. Earlier this year, I got roped into running this half marathon, which was probably one and done. And I lived in the boots for about 3 days after, just because every time you move, your cells create waste. And especially when you're running, your body's going to produce lactic acid. So one of the best things that you could do after like any kind of like long run training, even short run training, if you're having a production of lactic acid, like the heavy legs, so to speak, when you go in the Normatec compression boots, it kind of works with something called pneumatic compression. A good analogy is people always come in and they ask like, hey, those boots are great. Can I just buy like a pair of compression stockings to wear? You can, but it's a different effect. There's two types of people in this world. People, when you're at the end of your toothpaste, they just say, oh, I'm done, throw it away. And then you got people that kind of like inch every little last bit of toothpaste out of the, yeah, right. Everybody that tries to get the most out of it. So that's kind of what like the Normatec compression boots do is it works on pneumatic compression. So it actually squeezes from your foot to behind your calf to behind your knee to basically your thigh, and then all that blood, lactic acid, and metabolic waste goes through all your vital organs, gets highly oxygenated and nutrient dense. And so when the blood goes back down to your legs, you're basically just flushing everything out and getting all the good stuff in there for to heal. So I love those. A lot of my endurance athletes love those. And getting back to the title of this biohacking sports performance through chiropractic. I love treating people, love being hands on in the room, but we do a lot of different nutritional consults as well. So it really, really helped. And I was actually talking to a patient yesterday about it. There's a product we have, something called DMG. It stands for dimethylglycine. Very rare that you have a natural occurring substance in nature that has 5 U.S. patents. Two of the coolest patents it has is actually for melanoma and rheumatoid arthritis. But the highest dosage for the patient population that should be taking that is actually people that actively have cancer and then people that are endurance training. So what actually saved me during this half marathon, because I did not train properly whatsoever. I think I only ran 5 times, and the most I ran was 5.5 miles. So shame on me. But without sounding pompous or anything like that, my lungs felt really good and my muscles actually felt really good. My legs felt great. But since I didn't train properly and I didn't have enough miles on, it was killing my joints. But what I'm trying to get to is it's crazy that my legs felt so good and that basically my respiratory system felt good. And I really think taking the DMG, I was taking 2,500 milligrams a day just because it's a methyl donor. So it's actually indirectly going to help you produce less lactic acid. So you're going to be able to run further and at a higher pace without producing lactic acid. So your onset of your heavy legs during your run is going to be pushed back further and further. So that really, really helped me. And then I also took some of the Circucor just because the beetroot extract, it's a vasodilator. So nitric oxide produced in the endothelium of your artery. So like the inner part of your artery, if you take any kind of beetroot powder, it's basically just going to vasodilate, so open up your arteries so you have better blood flow. And so you'll in turn produce less lactic acid because you're getting more blood flow to your muscles. So that really saved me during the half marathon. I guess kind of going off topic, but another fun fact about training. A lot of people think that if you're going to train at altitude, you're going to perform a lot better when you come back down to kind of like sea level. Here's a cool fact. So the U.S. training grounds up in Denver, Colorado, they will train there and then they'll basically go to the Olympics. It's kind of tricky because when you train at altitude, your body and your cells produce something called 2,3-BPG, and that basically helps with oxygen affinity within the cell. So when you're training at altitude, you're actually going to be able to carry more oxygen throughout your body, a lot more efficient. The I guess the caveat to that is you have to have your event within 2 weeks after you're done training at altitude, because some people, they'll go, train in Denver for an event in a month, but your body will stop producing more and more 2-3 BPG within 2 weeks. So if you are a marathon athlete, if you're going to run any kind of triathlon and you're training at altitude, just make sure your event was within 2 weeks of that window, or else all that work at that altitude training kind of goes out the window. And I guess lastly, we'll end with a quote. Since we're on the golf topic, I mean, there's a ton of athletes that use chiropractors. I treat kids from middle school, high school, a couple professional boxers, D1 athletes, and a couple of professional athletes. And Tiger Woods, well, Jerry Rice, I would say, is probably the biggest one that kind of got chiropractic on the map for athletes. But and even Tiger Woods too didn't have a good weekend. But his quote was, "I've been going to chiropractors for as long as I can remember. It's almost as important. It's as important to my training and practicing my swing." And that's what's cool about one of my things I have too. I'm TPI certified in the Titleist Performance Institute. So it basically takes you through the 16 biomechanical movements of a golf swing. So it literally checks you from your neck all the way down to your ankles, and it sees where you move well and you do not move well. And then basically what I'll do is I'll work with different kind of golf coaches, and I'll work with different kind of trainers, and we'll kind of just work as a team of three just to kind of get the golfer as optimal as you can be. A lot of people say, well, if I do the TPI screen, is it going to help my golf score? Results vary. I haven't seen you on a putting green, and but I can tell you that you will feel a lot more comfortable swinging a golf club, just because we're going to increase your range of motion. And if you're having any kind of like aches and pains, like to say hole 12 or 13, your knee starts to hurt, your back starts to hurt, we're basically going to do all the treatment in the room to get you out of pain, number one. And then number two, we're going to give you different corrective stretches and exercises that you could do at home, just so you're not loading your low back. And a lot of people have problems with their low back in the golf swing because you have a lack of basically a lack of mobility through your hip or through your mid back. So I stress pretty heavily the thoracic rotation, just because the more you could rotate your thoracic spine and the better range of motion you have in your hip, the less pressure you're going to have on your low back. So you're not early extending, losing your posture, and then loading those discs how you don't want to load them. So I think that was enough rambling for me today. And if anybody has any questions, my lunch is from 1 to 2 p.m. every single day. But for and you could always call and just ask a couple questions to see if, coming to see me would help you, your son, your granddaughter. I love working with athletes. Number one, I was an athlete myself. I played soccer my whole life, played in grad school as well, or sorry, played in undergrad. And I don't know, like it helped me throughout my career, and I know everybody could benefit from it. And I just love when someone comes in and they say they feel all right, but then once you kind of like take them through a movement analysis and fine tune them, you just feel that much better. So I would just say, yeah, anybody listening at home, if you have a granddaughter, grandson, son or daughter that's high school playing sports, college playing sports, get them in here. Even if they have no current injury, we could basically just allow them to perform as optimal as they can. Outside mid. I was a runner. Le- left, lefty. Yep. And then I told myself I only run for fear and food now, but I got roped into that half marathon, and we're going to take a hiatus from running for a little bit. So thanks, guys, for sticking around. And then my colleague, Dr. Orbach, is going to be talking at noon today. He's going to be talking with Joe about the benefits of being a chiropractic patient and the top 3 formulations for restoring joints, ligaments, and tendons. Thanks, guys.